Good morning, ladies and gentlemen. This is the Truckers Podcast, FYI. I'm your host, Doug from Ontario, Canada. It is 8:36 a.m. Eastern Standard Time here on the 1st of September 2024. And welcome to the show, Labor Day weekend. I hope everybody is out there enjoying your last of your summer holidays. Talked a little bit about safety on our area roads and highways. School returns here in Ontario, Canada on September the 4th, which is Wednesday. School buses will be back on the road in full swing. Children walking to school, parents driving your kids to school. Pay attention. Don't be distracted while you're driving. Be aware of the school buses stopping and picking up children with their stop arms deployed, their lights flashing. Stop in both directions. Obey the speed limits so everybody can have a safe start to the school year. Now, I want to come out here and talk to you about do safe consumption sites work? The government of Ontario wants to shut them down and come up with some other sort of plan that they think is better. And we'll discuss what is a safe consumption site. But let's also start with stigma around drug use. Overdose-related deaths and other harms are affecting our friends, families, and communities. Addiction is not a choice. It is a treatable medical condition, yet many people affected by addictions face stigma. Stigma is negative attitudes, beliefs, or behaviors about or towards a group of people because of their situation in life. It includes discrimination, prejudice, judgment, and stereotypes, which can isolate people who use drugs. Thank you for joining me. I'm your host, Doug from Ontario, Canada. We'll be talking about do safe consumption sites work? What is a safe consumption site is where people can go safely into a location with healthcare professionals and use their drugs under supervision. The Ontario government wants to close them down and come up with some other plan of treatment. I want to talk about the stigma around drug use and what stigma is. So stigma makes it harder to reach out for help. It can make it easier for people to get support by letting them know they're not alone and that substance use does not define who they are. Addiction is a treatable medical condition, not a choice. And why does it matter? Why does stigma matter? People who use drugs, especially those struggling with addictions, face discrimination and barriers to getting help. They lead a person to avoid getting help because they are afraid of judgment or getting into trouble with work, their loved ones, or even the law. Cause a person to hide their drug use or use drugs alone. It affects people's ability to find housing and jobs, which affects their health and quality of life. Contribute to people who use drugs receiving a lower quality of care from healthcare professional systems, from the healthcare system when they access services. Addiction is not a choice. And there's this common misconception that addiction is a choice and that people can stop using drugs whenever they want to. Addiction is complex. People develop addictions because of many reasons including events in life, especially trauma and chronic stress, environmental factors, mental well-being, emotions, thoughts, feelings, and mental illness, genetics and biology. Some people try drugs once or use them occasionally. Others use drugs more often, sometimes to try to cope with trauma or pain. So no matter the reason, no one chooses to become an addict. Addiction and physical dependence make it hard to stop using drugs, even when it's hurting you or people in your life. Recovery is possible, but it looks different for everyone. There's 3 types of stigma. Self-stigma happens when people internalize negative messages about people who use drugs and apply them to themselves. Can lead to low self-esteem and feeling of shame. Can cause someone not to access support because they feel being judged or discriminated against. Can cause someone to hide their drug use or use drugs alone. Social stigma is the negative attitudes or behaviors towards people who use drugs or towards their friends and family members. Negative labels and images in everyday conversation and in the media. Talking about addiction like it's a choice. Judgment and discrimination from other people can lead to self-stigma and cause harm such as not reaching out for help or using drugs alone. Structural stigma. Policies in health and social services that increase stigma, such as not providing services until drug use is better managed. When healthcare providers or first responders do not take people affected by drug use seriously. Workplace policies that cause harm and unintentionally encourage people to hide their drug use or prevent them from seeking help. Example, unnecessary drug test. Not connecting people with health or social services because of their drug use and low quality of care when services are being assessed or being accessed. So when we talk about it, you know, changing how you talk about drug use and the language you use has a direct and deep impact on people around you. You can reduce stigma by changing the words you use to talk about drug use. Using kind words can make it easier for someone to speak up, to feel understood, or to receive help. Use person's first language, for example, say persons who uses drugs instead of drug user. Use neutral, medically accurate words when describing drug use. Avoid slang such as addict or a junkie. Use language that shows care and concern rather than judgment. Speak up when you hear someone being treated or talked to in a disrespectful way. Use language that acknowledges and promotes the fact that recovery from addiction is possible, and it looks different for everyone. We can help end the stigma. Do not define any person by their drug use. Be respectful, compassionate, and caring to those who use drugs. Educate yourself and your family. Pass on facts and challenge stereotypes. Remember that addiction is a treatable medical condition. Be aware of your attitudes and behaviors because they may be influenced by stereotypes, negative stories, images about people who use drugs. See, here in Ontario, the Ontario government and the very same Ontario government is putting a ban on supervised consumption sites, closes locations the federal government as previously approved. These very consumption sites that people go to save lives. So these supervised consumption sites where addicts can safely take drugs to avoid the risk of overdose were approved by the very same government that's now looking to shut them down amid public safety concerns. In fact, more than half of the 10 sites announced for closure by the health minister were opened and funded by this very same government in the early 2019s as politicians grappled with the provincial overdose crisis. And despite opening and funding many of the centers it now plans to close, the government said its new policy was about doing more to protect public safety. The policy shift unveiled by this government means supervised consumption sites within 200 meters of schools and childcare facilities must close by next March. This policy has been criticized by prominent people of these facilities, which they say have saved countless lives, some fatal overdoses that have become more common with an increasingly contaminated drug supply. And it took a ton of work for these communities to put these proposals together to get the government to finally get funding for these supervised consumption sites. The government did fund them. Now it's done a complete 180. So a spokesperson for the Ministry of Health told Global News that crime had risen around supervised consumption sites and that the change would protect the most vulnerable people in Ontario, namely children. When the sites were opened in 2019, the application process included extra measure for those located near schools and child care centers, which needed to declare their proximity when they applied. They approved all these sites. The government, this very same government, approved all these sites where their locations are. They want to spend something like $378 million on treatment. So with the government closing down these safe consumption sites, they will no longer be able to use them as a safe consumption site. They will no longer be providing safe needle exchanges. People who are addicted to these street drugs will not have a safe place to consume them. Pierre Poilievre, excuse me, the leader of the Conservative Party in the federal government, was asked, well, since the Ontario government is going to be closing these safe consumption sites, would the government be able to force people into treatment, physically remove them from the streets. His answer, you'd have to look into that. The answer is simple. The answer is no. You can't forcibly make anybody to do anything against their will. So the supervised consumption sites, types of sites and services. The supervised consumption site services save lives and benefit communities. Supervised consumption sites provide a safe, clean space for people to bring their own drugs to use in the presence of trained staff. This prevents accidental overdoses and reduces the spread of infectious diseases such as HIV. And like I said, when they close these safe consumption sites, there'll be no needle exchange programs. These supervised consumption sites may offer a range of evidence-based harm reduction services, such as drug checking. The site also provides access to important health and social services. So the Ontario government is aiming towards that. But basically saying that you have to go for treatment. You don't have a choice because there isn't going to be a place for you to safely use your drugs. These places provide these wide range of services, including substance use treatment for those who are ready. Canadian and international evidence show clearly that supervised consumption site services help save lives, connect people to social services, and serve a pathway to treatment. And when they're properly established, these sites and services reduce the risk of accidental overdose, excuse me, because people are not rushing or using alone, connect people to social services, provide or connect people to healthcare and treatment, reduce public drug use and discarded drug equipment, reduce the spread of infectious diseases, reduce the strain on emergency medical services so they can focus on other emergencies, provide space for people to connect with staff and peers, which can help a person moderate their drug use and decide to pursue treatment. The services that are offered at these sites. Sites are set up in areas where there are high rates of public drug use to provide important health, social, and treatment services. Access to clean drug use equipment and a place to safely dispose of items. See, now there is not going to be these needle exchange programs. And before we had the safe consumption sites, and then in the high rates of public areas, there were discarded needles everywhere. Drug checking to detect if drugs contain other, more harmful substances. Emergency medical care in case of overdose, cardiac arrest. Basic health services such as wound care. Testing for infectious diseases like HIV, hepatitis C, and other sexually transmitted infections. Gives them access to healthcare providers and support staff, including mental health treatment, education on the harms of drug use, safer consumption practices, and safer sex, access to medications to treat opioid use disorder under the oversight of a healthcare provider, referrals for drug treatment, rehabilitation, and other health services, access to referrals to social services. So what happens at these sites? A person brings their drugs in to a site to consume. Depending on the site, drugs are injected, snorted, inhaled, or consumed as pills. Trained staff are available to help if there is an accidental overdose. Needs of the community determine hours of operation for sites and types of services provided. Type of staff varies by site, but generally includes a nursing staff, social workers, and peer and community workers. These urgent public health need these sites. So, into order to assist provincial and territorial governments in their ongoing efforts to address the effects of the opiate overdose crisis, these provinces and territories have been issued a class exemption from the Controlled Drugs and Substance Act in relation to the urgent public health need sites. And these exemptions authorize the Minister of Health in each province and territory to establish urgent public health need sites as required within their province or territory. About safer supply services and their benefits. Well, by taking away the safe supply and these services that are offered at these safe consumption sites, and these healthcare professionals running these sites, this is going by closing them is a death sentence for people with addictions. The overdose crisis right across Canada have been reduced because of these safe consumption sites. So the role of a safer supply in addressing Canada's drug overdose crisis, the drug overdose crisis continues to have a devastating impacts on Canadian communities and families. So these illegal drugs supply chains, like the strong opiates such as fentanyl and other toxic substances causing high rates of overdoses and deaths. COVID-19 pandemic has also contributed to the worsening overdose crisis. with some communities reporting high numbers of overdose deaths, hospitalizations, emergency medical service calls. Safer supply services provide an alternative to the toxic illegal drug supply as a way to help prevent overdoses and connect people to other health services. Now, the Good Samaritan Drug Overdose Act applies to anyone seeking emergency support during an overdose, including the persons experiencing an overdose. Good Samaritan Drug Overdose Act to help raise awareness about the law and the importance of calling 911 or your local emergency number in case of an overdose. And what that does, the Good Samaritan Drug Overdose Act provides some legal protection for individuals who seek emergency help during an overdose. So if you have a low quantity of drugs for personal use, you're not going to be charged. And anybody in that area or with that person, they have a low quantity for personal use, you're not going to be charged. Right? The act can protect you from charges of possession of a controlled substance under the section, breach of conditions regarding simple possession of controlled substances, pretrial release, probation orders, conditional sentence, parole. So this Good Samaritan Drug Overdose Act applies to anyone seeking emergency support during an overdose, including persons experiencing overdose. The act protects the person who seeks help, whether they stay or leave from the overdose scene before help arrives. The act also protects anyone else who is at the scene when help arrives. But the act does not provide legal protection against more serious offenses such as outstanding warrants, production and trafficking of controlled substances, all other crimes not outlined within the act. These sites work in helping prevent overdose. What plan does the Ontario government have really in place, or maybe working on stuff like that? They don't have anything in place. Yeah, they want to spend $378 million on treatment. When these places have proven harm reduction, directing the people to services to help them, such as treatment. You can't make people go into treatment. can't force them into treatment. They have to want treatment. How this is going to play out with the government, the Ontario government, that's a wait and see. Is it going to backfire on the government? And of all people, Doug Ford, the Premier of Ontario, should know and understand that these safe consumption sites work. His brother died because of drug use. It's not just, here in Canada, United States and everything else, to the crisis is everywhere. Before and during and after the pandemic, um, you know, um, Vancouver, British Columbia, on the west coast of Canada, the lower east side of Vancouver is the epic center at one point in time of overdose. Things have gotten better there because of these safe consumption sites. By closing these safe consumption sites and doing the government doing the exact thing that these sites offer it for treatment, to direct you towards the treatment that you need if you want the treatment. But the other problem the other problem the government's going to have is with this, when they say that these safe consumption sites, you can no longer use them for your drugs. No more needle exchanges. We're going to go right back to where we were, and in the areas where these safe consumption sites are, we are going to have discarded needles all over the place, all over again. And more than likely, the overdose rate is going to increase. Deaths are going to increase. Spread like hepatitis C, HIV, other sexually transmitted diseases. I mean, does the Ontario government, think that HIV is gone? That hepatitis C is gone? And other sexual transmitted diseases? You think that's all gone? It's not. It's urgent that these public health, we need these sites. We need to have them. Sure, the government can look for other treatments and other ways of helping people, but we still need these sites. We still need the harm reduction. And like I said, if the government thinks that they're going to just be able to force people into treatment against their will, they're sadly mistaken. People are going to use, if they can't use them as a safe consumption site, people are going to use them in your neighborhoods. People are going to use them around schools. People are going to use them around playgrounds. People are going to use them around everywhere they possibly can, because they'll no longer have a safe place to go. And if their idea of closing down these safe consumption sites to hopefully move them out of those areas of playgrounds and schools and other neighborhoods, they're sadly mistaken. That is not going to happen. What are other provinces going to do? I don't know. They're certainly going to be watching closely of what, once they, by next March, which by the way is not far away. This is September. You got October, November, December, January, February, March. 6 months. And if the government thinks they're going to fix this this crisis, they're sadly mistaken. In 6 months, they're sadly mistaken. They think they're going to fix this crisis in 6 months with their idea of treatment. Is better. Their idea of treatment is better than these safe consumption sites. They already provide all the services. What the government already wants to do with this $378 million. We're gonna find out. Harm reduction is the first step. That's why these sites became to what they are today. Approved by the same government that is going to take those services away. Harm reduction. It is crucial in addressing the opioid overdose crisis. And these safe consumption sites have been instrumental in saving lives and improving public health outcomes. But somehow the Ontario government doesn't get that. People who run these safe consumption sites, these professionals, healthcare professionals, They know at the end of the day that once these sites are stopped and people can no longer access them for safe consumption, they know that the overdose rate is going to increase. It's going to put even more of a strain on the emergency personnel. On hospitals. If you survive an overdose, they just send you back out into the street. I really feel that the Ontario government is making a grave mistake. I was looking at a page earlier, and I'm not sure where it went now. Whoops, I don't want to do that. So naloxone, it helps temporarily reverse an overdose. How it works, and I hear people here in Ontario and across Canada, you can get that kit free from the pharmacies. And what it is, it's a fast-acting drug used to temporarily reverse the effects of an opiate, excuse me, overdose, and it can restore breathing within 2 to 5 minutes. Excuse me. And it only active in the body for 20 to 90 minutes. Excuse me. So that's why it's important, to have these safe consumption sites. So once this reversing drug, is likely to wear off, before the opioids are gone from the body, which causes breathing to stop, again, it's important to call for emergency medical attention. And it may be needed to be used again, depending on the type and how the opioids were taken, whether it was oral or you injected it. I think that the Ontario government, either they need to change course, they can, do that, or they can do one or two things. They can keep these consumption sites open while their so-called plan comes into transition. Like I said, other provinces are going to be watching to see if the government's new idea is going to be effective. There are other problems here. Um, where'd this one go? Pierre Poilievre, the leader of the Conservative Party in the federal government, misconceptions on these safe consumption sites, saying that these drugs are getting in the hands of children, which is not true. Absolutely not true. Kids are not going into these safe consumption sites and using these safe consumption sites, as he said. That it's not true. It's just really ridiculous to even to state that. Not surprised coming from a politician like Pierre Poilievre. And a person like him who doesn't know or understand that um, that you can't force people into treatment. So this prairie harm reduction, is responding to the federal opposition leader Pierre Poilievre's comments on supervised consumption sites, arguing that they're not based on research. He goes, Pierre Poilievre, he says, you call them experts? They're not experts. They're experts only at one thing, and that is perpetuating the drug crisis. He also added that he would like to see funding cut to the sites and that the focus should be moved to treatment and recovery. They already do this. They already offer these services. See, this is what he knows nothing about these safe consumption sites. He says he goes on to say that's what you're doing when you say safe supply. It's heroin grade opioids that they want to give out and is being diverted to kids. It's not safe. Since this policy was enacted, we have seen overdose rates more than double across Canada. It's ridiculous. So the overdoses occurring are happening outside of the facilities, and that Poilievre's comments on drugs are being diverted to kids is absurd. So the deaths that are happening are from outside of the supervised consumption sites. It's due to the unregulated toxic drug supply. That's what's killing people. is very misinformed. He is very misinformed when he talks about, but there is no kids going into supervised consumption sites and getting drugs. That's not happening. Pierre Polyev doesn't know what he's talking about. He has no idea. Yes, we want to help people. Yes, we want to provide them with the services. But you can't make them take treatment. When I was watching that interview, and when Pierre Polyev was asked if the government would be able to force people into treatment, physically remove them from the streets, he said he would have to look into that. And then I asked myself, why the hell are you in politics? If you don't know that the simple answer is no, you can't force people into treatment. You know, the old saying goes, you can lead a horse to water, but you can't make it drink. You can lead people into treatment. They don't have to take the treatment. They can get up and leave. Well, like I said, we're going to have to just wait and see how this plays out over the next coming months and what sort of plan the provincial government is going to have in place in order to prevent overdoses. Because they're certainly not going to get the drugs off the street. September the 1st already. I can't even believe I'm saying that. September the 1st. Here in Ontario, the schools return back to class on Wednesday, September the 4th. School buses will be out in force. Children walking to school. Parents driving their kids to school. Pay attention. Stop for school buses in both directions when the stop arm has been deployed and the lights are flashing. Stop for crossing guards when they're crossing the children. Kids are going to be excited to get back to class. Kids are going to be excited to see their friends. Drive safe out there and pay attention. We want everyone to have a safe start to this school year. Thank you for coming out here and joining me here on the Truckers Podcast. FYI, I enjoy your company. Being that this is a long weekend, tomorrow is Labor Day. That is the statutory holiday. I will be back out here tomorrow morning at 8:30 a.m. Eastern Standard Time to do another show. And I'm glad I took a 4-day weekend. I had Friday off and I have Monday off. And to get 4 shows in, I think that's great. Because during the regular work week, believe me, I tried. I tried to set up like a Tuesday, Wednesday, Friday thing, and that did not work. On Monday, Monday, Wednesday, Friday. That did not work. Tried to get that, and then do Saturday mornings and Sunday mornings. Thursdays seem to be the lighter day to get a show out on a Thursday evening than it is Monday, Tuesday, Wednesday, Friday. Then, of course, Saturday mornings and Sunday mornings, which we'll be coming out to do as well. I'll take your call quickly. Oh, okay. Guess I won't do that. But anyways, I was just about to end the show here. So get out there, enjoy the rest of your long weekend with your family and friends, and whatever you're going to be doing out there, be safe. We want everybody to be able to go to school, return to class. It's going to be clear blue skies here in southern Ontario. It's going to be a relatively warm day. So get out there and enjoy it and have fun. Thank you for joining me. This is the Truckers Podcast, FYI. I'm your host, Doug from Ontario, Canada. Take care.